Hey everyone, Dr. Michael here. So in this video we're going to have a little bit of a chat about dental anxiety and just being anxious about coming to the dentist in general. So here at Semaphore Dental we see all types of patients, both patients who enjoy coming to the dentist as well as people who don't enjoy coming to the dentist. Now the vast majority of people don't enjoy coming to the dentist, and that is completely fine. It's not something that a lot of people choose to do. I mean, people don't choose to have a broken tooth, people don't choose to break their leg and go to the doctor. Things just happen and they need treatment. So we're always going to be there to provide treatment to people, regardless of if, they really enjoy coming in or not. Where we may be a little bit different than other clinics is all of the dentists here have a lot of experience with managing patients who have dental fear or dental anxiety. What do we mean by that? So we get a lot of patients who take years to come in to even just sit down and speak with the dentist because they're that sort of scared or they're just that nervous. And it tends to be for one of two reasons. Either they had a really traumatic experience when they were a child, or they've had people tell them a lot of stories of their bad experiences, and then that's just sort of compounded over the years, and then it just ends up in just a really big scary situation in their head. So the things that we do at Semaphore Dental a little bit differently is we always take the time to speak with you, get to know you and your needs before sitting down and looking in your mouth. So the last thing we want to do is just lie you back in a chair and just have a good look at everything. That's not what we do. We'll always sit down, we will have a bit of a chat, see what your needs are. What do you expect from us? What are your sort of trigger points in sort of the dental field? And then find ways to get around those in a safe way for both you and for us. Now, there are some things that are going to be a little bit challenging to get around. So some people don't like having, people with large hands in their mouth, or some people don't like using certain tools or certain instruments. Now, in some cases, there's going to be ways around that. In other cases, we may have to figure out some sort of compromise in the situation. So we have many different dentists with various different sort of skills and skill sets, but we're all well able to manage patients with dental anxieties. So we have a few different tools and tricks up our sleeves. So one, like we said, is we always take the time and effort to sort of get to know you and your individual needs. Above that, we have various different sort of oral sedatives that can be taken, sort of like a little tablet that you can take, which takes the edge off of things. So we provide you with a tablet that you take while you're waiting in the reception area. And then after about an hour, hour and a half, things start to mellow out, and then you're able to get whatever treatment is needed from there. That obviously is going to be only for certain patients, and that is pending obviously a full medical history check just to make sure that it's suitable for you. We also have available happy gas, so we do use that quite a lot with kids. Some adults really have positive experiences with it. If you've never had it before, then we can also guide you through that process as well. We do also have available to us a specially trained dentist who can come in and provide sort of a higher level of sedation, is probably the way that we would call it. It's not knocking you out and putting you to sleep like you would be in hospital, but more just calming things down a lot more than we would be able to manage, let's say, with just a sedative tablet or with happy gas or something like that. So they are specially trained, and they will be constantly there to monitor you throughout the procedure to make sure that everything is going completely okay with the procedure and with that keeping you comfortable as well. We do also have the facilities to see patients under general anaesthetic if required, not at the practice, but either at a hospital, or we can refer you to a different specialist facility that we do liaise with quite often that does have an in-house general theatre where some treatment can be provided under general anaesthetic. So we have a full range of services available to help patients with dental anxiety. But the main thing is making that initial appointment, having a chat, and then seeing where your level of anxiety and your level of need is, and then organising whatever appropriate course of action is required from there.